Hi, I'm Dr. Goh Hui Yi. I'm a consultant obstetrician and gynecologist in Park City Medical Centre. Confinement itself is a very much cultural concept rather than medical actually, and being Western trained, I actually don't really believe in the concept of confinement. So in general, how do you care for yourself after delivery? Well, the principles of confinement are correct. You need adequate rest, you need adequate nutrition, so what you eat and drink is really important. And here I will say that a lot of confinement traditional practices actually I discourage my patients from following, such as not drinking water at all. So red date water is fine, but I think you also need just normal water, particularly if you are breastfeeding. Things like the use of herbs and traditional foods. I'm actually quite reluctant for my patients to take a lot of herbs. Sometimes they cause increase in bleeding. But if something does not cause harm and they wish to follow it, then that's fine. So general rest and nutrition, that's important. And of course, caring for whatever wounds you may have. So depending on how you delivered, if you had a normal vaginal delivery, then you may have stitches down there. And so your doctor will teach you how to take care of them. For my patients, I always tell them 3 rules. I say use the salt baths that we start in the hospital. So it's a basin, warm water, a bit of salt, and you sit in it for about 5 to 10 minutes each morning and evening for about 2 weeks. The second thing I always tell them is don't squat for 2 weeks because you don't want the stitches to be strained. And the third thing is to rinse after going to poo and pee and then just dabbing dry. So that's for a wound if you had a normal delivery. For C-section patients though, of course the wound care is very different. And so again, your doctor will tell you, every doctor is slightly different in their advice. But in general, I tell my patients that for the first week after they go home, they actually don't need to do much because I put a waterproof dressing on. They can shower as per normal. Just don't do anything that will stretch the edges apart. So no twisting, no stretching, but walking up a flight of stairs, moving around the home is actually to be encouraged. So it's actually super important for a woman after childbirth to actually pay some attention to herself. So what I mean by that is you don't have to go back to being exactly the same weight, but certainly you shouldn't neglect yourself. And so I tell patients that there are a few components to pay attention to. The first, of course, is extra weight. The moment you deliver, you have to get into the mindset that you want to shed the extra weight. A lot of people have this incorrect view, I feel, that you should just wait until you've had all your children and then you lose weight. So, you have one child, then you don't bother about losing the weight. Then you have another one. And then when you finally finish, then you lose it all. I tell my patients, if you do that, what happens is that your weight goes from this to this, and then like that, and then like that, and then it never really ever comes down again. So you've got to cut your calorie intake and not eat excessively, even in confinement, even with the confinement lady insisting that you eat 3 big meals a day. And of course, you've got to also pay attention to eating nutritious and whole foods, not processed foods. And of course, exercise is really, really important. And under exercise, I tell my patients to do 3 components. So it's not just walking or running or biking, but then there's also the second component of strength training and the third component of pelvic floor and core work. So you need to start rebuilding muscle strength by doing simple things like weights with dumbbells at home or even body weight exercises. And now with YouTube, there's just so much you can do online that is free in the privacy of your own home. The third component is core. When the body is pregnant, the core takes a huge stress actually. The core consists of the abdominal or tummy muscles, the back, and the pelvic floor, which is this big hammock of muscles that sits inside our pelvic bone. And you can imagine, right? You're walking around with a weight sitting on that pelvic floor, and then you push it out. Sometimes women push for an hour. So that strain will weaken all the muscles down there. To strengthen these muscles is actually quite difficult because I can't show my patients like a bicep curl, you can see it. I tell them actually that if you can, Pilates is actually the best form, I feel. There are good resources online as well. If you key in, postpartum pelvic floor work, there will be some exercises that you can follow. And the third thing that I want to say is that the skin of the tummy, a lot of women are very concerned about the loose skin, the dullness, the dryness. So it's important to pay attention to skin quality, and how you do that is by making sure you scrub the area. If you have a C-section, please wait 6 weeks after the actual operation scrub the area to get the skin to slough off the dry cells, and then moisturize regularly at least once or twice a day. And I think those are the main things that will. So again, this is something I talk about a lot. I always tell them this is the take-home message at the 6-week visit. And I always explicitly say, if you are breastfeeding, and even if you're fully breastfeeding, 100% no formula, no water, and you haven't had a period, you can get pregnant, you can conceive. So this is a common misconception, right? People think, I'm breastfeeding, I haven't had a period, so I can have sex without protection and I won't conceive. This is a mistake. And this is how you end up with 2 children within 12 months. So the short answer is you absolutely have to use contraception if there is sex at all, at any point after delivering, no matter how impossible you may think it is. I rarely recommend supplements as a general rule, but during pregnancy, yes, the 2 broad components that I would recommend for pregnancy and breastfeeding are a multivitamin designed for pregnancy and breastfeeding so that all the doses of the various components are pre-calculated. That usually will include fish oil or DHA, so that's one. And the second is calcium, which is unfortunately quite deficient in a lot of Asian diets. So those 2 things are sufficient throughout the pregnancy and then also during breastfeeding. I think those are sufficient. If the woman stops breastfeeding and she wants to then stop all those supplements, I would say that's fine. I think paying more attention to diet actually and eating really healthily, a broad range of whole foods, I think is more important than a pill. There's one more thing that I usually encourage my patients, particularly first-time mums actually, who are struggling a bit with mood and stress. So I always encourage them to make sure they have some time, protected time for themselves. Now, in society, motherhood is supposed to be selfless and completely 100% sacrificial. And that kind of pressure unfortunately leads to a lot of women struggling actually with coping with the birth of a baby. And then they're conflicted because they feel sad, sometimes teary, sometimes depressed, but yet they're feeling bad for being a bad mother for having those feelings. So I usually encourage them, if they have a parent or a parent-in-law or even their partner, their husband, to take the baby, for an hour, 2 hours or a bit longer, at least once a week, if possible more. And that time be set aside for her, for the mother to do whatever she wants. And for her to act. I tell them, leave the house. If you want to, go to a cafe, sit there and do whatever you want, meet a friend, read a book, go for a pedicure, whatever makes you happy, but separate yourself from the baby and just leave it all behind so that you have protected time for your own mental well-being. And I think we need to kind of get rid of this idea that a mother should be 100%, 101%, 24/7, fully only focusing on this child. Because in the end, you are a better mother if you yourself are happy and taken care of. And your child will then be a happier child. And I firmly believe this.